about the yellow or red flags for your headache? Probably not. Let's talk about it. My name is Dr. Ubaidulhaq. I have experience of treating headaches and chronic pain for the last more than 10 years. Let's dive into it right now. When we talk about yellow flags or the red flags, I want you to think about the traffic light. When the traffic light gets yellow, that is a sign of caution. Same thing applies to the yellow flags for the headache. So we'll talk about few types of headaches or characteristics of headache which will need your attention. You do not want to sit on it. Ready? Let's do it. So one of the most common type of headache which people can get is they have a fever which is high grade fever and they're suffering with bad headache. In most of the cases, this might not mean anything bad happening in your brain or the covering of the brain, but you want to keep an eye. If the headache continues, if the headache worsens, and your fever is not getting better, please go and see a doctor. Next type of headache which will need your attention is the one which you start getting in one side of your head, especially if you are more than 50 years old. That needs your attention. You should go and see your doctor because one type of headache can cause loss of your vision in that eye. So it is important that if this is something new you never had before, you are not diagnosed with a migraine, and this headache is not getting better, it's time to see a neurologist or a headache specialist. If you are experiencing headache which is waking you up at night, and also that headache is getting worse over the weeks, and adding more fuel to the fire, your headache is always there. You don't come back to your baseline. You are always in some degree of headache. That can be a bad sign. That might mean that there's something happening inside the brain or around your head and neck area. That is again a time for you to seek medical attention, or definitely see a neurologist or a headache specialist or a pain management doctor. Okay. Now, one of the most common modalities in the headache, which many people either don't know or they are not able to pinpoint why that is happening, and that is called medication overuse headache. Yes, you heard me correctly. These medications you take over the counter, ibuprofen, Advil, naproxen, to some extent Tylenol, if you keep taking them on a regular basis, frequently, instead of giving you relief with a headache, they can cause headache. So if you are someone who has been taking over the counter pain medication on a regular basis, and recently you have noticed that your headache is not getting better and rather it's getting worse, please make an appointment to see your primary care or a headache doctor. Now let's talk about the red flags when somebody is suffering with headache. The good news is that most of the headaches, I would say more than 90%, they are called primary headaches, meaning that there is nothing wrong in your brain. There is no tumor or a lesion which might be contributing to your headache. But then there are some headaches which we call secondary headaches, and there can be some underlying abnormality or what we call organic cause to it. Let's talk about it. The first in the category of bad headache is fever, which is getting worse, severe headache, then some neck stiffness, and making things worse, if the consciousness of that person is getting worse, meaning the person is confused, not making sense, there is a time to call 911. There can be infection in your brain, there can be infection of the membranes of the brain, there can be an abscess in the brain, and you don't want to sit on it. If somebody is suffering with history of cancer, meaning somebody had a cancer in the past of any organ, any part of the body, recovered from it, or still getting treatment for that, and now start developing headaches, and the patient is telling the family and the doctor, this headache is different. I never had this before. That should be taken very seriously. And the reason is, there is a chance that the cancer can spread in the brain, and that can present with headache. Also, it can present with other symptoms like weakness or numbness in any part of the body, maybe vision loss, maybe droopy face. But with a history of cancer, a new onset of headache does need immediate medical attention, and most likely will benefit from sophisticated imaging of the brain like an MRI. If someone develops a headache describing the worst headache of their life. Sometimes it is described as thunderclap headache, like it hits you like a thunder. That is again a medical emergency. You need to call 911 immediately because the underlying cause can be bleeding in the brain. It can be a hemorrhagic stroke. You do not want to delay it. The next type of headache I'm going to talk about is the one which gets worse with changing in the posture, changing in the position. For example, if you are sitting and you stand up and your headache gets worse, and that is the pattern which is going on, you need to be careful and pay attention to it because that can mean there might be decreased or increased pressure in the brain due to different problems, different causes. One of the most common one is when a female who is going to give birth gets a spinal anesthesia and the needle goes too far and cause the leak of spinal fluid, that patient can present with positional headache, which is not getting better. So please, that is the time to see a doctor, discuss that, and get the proper treatment before it's. If your headache is getting worse when you sneeze, when you cough, when you go for number two, and you are trying to strain, and you are getting bad headache, and making things even worse, and you notice that your vision is progressively getting worse. Those are all the signs telling you to see a neurologist, an eye doctor, or a pain doctor to get examined right away because that can be an indication of increased pressure in your brain, which can be happening to different causes. It can be a tumor, it can be increased production of the CSF or the fluid in your brain, it can be obstruction in our fluid system or the ventricular system, which is regulating the flow of the fluid in the brain. So please do not sit on it. You want to get that checked ASAP. If you are suffering with a condition which compromises your immune system, that can be an immune deficiency of any kind, any of the diseases like HIV, which is uncontrolled, or you are taking chronic steroids or any of the medication which can lower your immune system. And now you have this headache which is not going away, rather it's getting worse. That needs medical attention. That needs to be checked. Most likely you will benefit from imaging of the brain like an MRI to rule out any infection, to rule out any abscess or any of the lesions in the brain which can explain that. Now, the next one I want to talk about is a female who is pregnant and she is experiencing this headache, which she describes is different. She had never experienced that before. So that also needs to be looked at, needs to be evaluated because there are certain conditions which can be really, really bad for the pregnant female and the fetus. To name the few, preeclampsia, eclampsia, gestational diabetes, or sometimes worsening anemia can present with new onset of headache. That needs to be checked ASAP and acted upon based on what is the underlying pathology of that headache. One of the last one which I want to touch base is where somebody is presenting with painful eye movements. What does that mean? That when you're looking up, looking down, looking sideways, and you are experiencing bad headache along with it, that can point towards a pathology or the disease process which is happening around the eyeball, the nerve which is taking the vision signals from the eyeball to the brain, or it can be a lesion in the brain as itself. Sometimes people who have chronic sinusitis, if the infection spreads and goes around the eyeball area, that can also present in a similar way. That needs to be checked right away before it's too late, before the infection or the disease process spreads in the brain. I hope you guys like the video. A lot of thought process, research, reading goes into all this. I would encourage all of you that please watch the video, share it with your friends, your family who might be suffering with the same type of problems, and spread the word. If you like it, hit the subscribe button. That will help us to get this message to the vast majority of people who might benefit from it. Thank you very much. and have a blessed day.